Ever heal? Also, bad looking scar on face, not where stitches were even put. I had a mini facelift about 5 weeks ago by a plastic surgeon. I've seen that his work is normally very good. However, I think my ears are a mess. I still have scabs that are not healing at the back. I was on antibiotic cream until the 4th week and was asked to put on hydrocortisone until the 5th week. I am due to see the plastic surgeon soon. I think this is going to scar badly. 1 week after operation, a scab came in front of the ear. The plastic surgeon said that this will fall off eventually and said that the scar would be okay after 2 weeks, but then it has gotten worse since. Do I have pixie ears and is the scar bad?
Thank you for your question. You had a mini lift a few weeks before you submitted your question, and you sent some very good photos of areas of scabbing, and your doctor has been staying on top of this with you as far as preventing infection with antibiotic creams as well as use of topical hydrocortisone. So you asked a couple of questions. One is, do you have a pixie ear? And two is about whether or not these are going to heal badly. Well, first let's understand what is likely happening as far as your healing process. The thing about facelifting surgery is that the very edge of the skin flap, the very end where the sutures are done along the ear, is an area that has the least amount of oxygen or blood supply by nature of the separation of the skin. So it's very important that proper blood supply be there. Now, even in patients who are non-smokers, sometimes there can be some compromise. And so one of the things I make sure that my patients know about is to avoid smoking. And if people who are, and of course in your question you didn't mention anything about a history of smoking, but just to illustrate the concept, anything that compromises blood supply can potentially cause the skin to have stress and develop a compromise in its integrity. Okay, so what is likely the situation is there is some compromise of the blood supply in the skin flap, and that you've been dealing with this breakdown of the skin and the resultant scabbing because there's bleeding. And so it's just very critical at the time when there is this scabbing period and there's a compromise that we prevent any antibacterial infection. So of course, certainly your surgeon is right on track with you. As far as whether or not you have a pixie ear, well, a pixie ear by definition is an earlobe that tends to be pulled downward. And that's why it's called a pixie ear. It looks like a little point. And so from the photo you submitted of your left ear, which looks rounded, I can't say that you have a pixie ear. As far as the skin healing future, I can tell you that even some patients who are smokers who develop, or ex-smokers who develop necrosis where things turn black and become really compromised, there is a lot of patients who do pretty well despite having problems with skin healing. And there are certainly things that can be done. In my practice, I happen to be fortunate in having a lot of experience with a material called extracellular matrix, which we use in our incisions to help the healing process, and it heals by duplication of the normal cells so that the incision lines heal beautifully. And in a situation like yours, it really sounds like your surgeon is right on track, and it basically is a matter of time to see how things heal. So I wouldn't say that your future is bleak at all. I think you should continue working with your surgeon as far as managing these issues. Make sure you avoid touching those areas too much. Wash your hands frequently, and just as soon as this all settles out, and typically we would wait about 6 months before planning any type of revisional work or any type of other interventions to help with the cosmetic appearance. So again, it's very good that you're protecting the skin and staying in close coordination with your surgeon, and just wait this out. Hopefully, things get better, and ultimately you should probably do well. So I hope that was helpful, and thank you for your question.